Prenatal correction of X-linked hypohidrotic ectodermal dysplasia. Definition: genetic deficiency of ectodysplasia AAEDA causes X-linked hypohidrotic ectodermal dysplasia XLHED, in which the development of sweat glands is irreversibly impaired, a condition that can lead to life-threatening hyperthermia. Pros and cons. Pros: normal development of the tail, hair, and sweat glands in EDA deficient pups that were fed on his milk occurred only they had expressions of the neonatal Fc receptor. Cons: the inability to sweat, the most severe clinical problem among patients with XLHED, can lead to life-threatening hyperthermia after birth. Application in MED. The serum half of MABEDARI was longer than that of the FCEDA. 10 days in adult means with a single type allele of the neonatal Fc receptor, like in null mice. The surprising efficacy of MABEDARI in the absence of neonatal Fc receptor might be explained by the fact that exposure to EDAR agonists for only 4 hours is sufficient to permanently correct the tail hair phenotype in newborn EDA deficient mice. Issue applied in Ecuador. In February 2016, at week 26 of gestation, the affected twins were treated in utero. Amniocentesis of both which was performed to obtain amniotic fluid for genetic testing and to inject FCEDA at a dose of 100 milligrams per kilogram of estimated fed after administration, and during the following day, no FCEDA was detectable in the circulation of the pregnant woman. Conclusion: we concluded from these experiments that FCEDA provided in amniotic fluids must first enter the organism in a manner that is dependent on the neonatal Fc receptor, presumably through the gut, before it can act on the developing EDA-dependent structures. The increased serum of half-life of FCEDA in the presence of neonatal Fc receptor further enhances its efficiency.
Ectodermal dysplasia. Ectodermal dysplasia, a genetic disorder in which the skin and associated structures, the hair, nails, teeth, and sweat glands, develop abnormally. X-linked anhidrotic, non-sweating, ectodermal dysplasia is most common. Because it is an X-linked trait, it mainly affects males. There is also an autosomal dominant form that affects both males and females. The term ectodermal dysplasia refers to the abnormal development, dysplasia, of structures derived from one of the germ cell layers in the embryo, ectoderm. E, C, T, O, D, E, R,